Okay, let's jump right into the deep dive. We're here to take a stack of source material, cut through the noise, and get you straight to the crucial insights. Think of it as your shortcut to being well informed. Today, we're tackling a challenge that touches just countless lives globally: chronic diseases. Managing conditions like diabetes, heart disease, respiratory illnesses. It's incredibly complex, isn't it? You've got the endless appointments, the medication schedules, trying to understand test results. It's just this constant flow of information. It can feel, well, overwhelming for everyone involved, patients and doctors alike. But what if technology could fundamentally change how we approach chronic care? What if we could use, intelligent tools to simplify things, to augment human capabilities, and ultimately to improve outcomes for people living with these long-term conditions? This is really where artificial intelligence, or AI, steps onto the stage. For this deep dive, we've been given access to excerpts from a book exploring the vast and rapidly evolving landscape of AI in healthcare. Our mission is focused to extract the most important insights and practical applications of how AI is being used and can be used specifically to help manage chronic diseases, drawing only from the pages of the source material. Let's unpack this.
Okay, so to start, the book makes a really key point. AI in healthcare isn't some single magic bullet. It's more like a spectrum of different tools, right? Each one suited for different tasks. Think of it less as one big solution and more like a diverse toolkit for tackling various challenges, especially in chronic care. The source talks about a few key types. You've got sort of traditional rule-based systems. They're great for very specific predefined checks, like maybe flagging a potential drug interaction based on known guidelines. Predictable, but a bit brittle. They struggle with complexity. Then you have machine learning, ML. This is where it gets interesting because it learns patterns directly from large amounts of data. It makes predictions, identifies insights that aren't immediately obvious, and it improves over time. The book actually uses this analogy of training a medical student by just feeding them lots and lots of data and examples. And then there are large language models, LLMs. These are trained on massive amounts of text data. So they're incredibly powerful for understanding, summarizing, and generating human language, which, as you can imagine, has huge implications for managing all the information surrounding chronic conditions. Understanding the difference, the source stresses, is crucial. It's like knowing whether you need a scalpel or a stethoscope for the job.
Okay, got it. So AI is a set of distinct tools.
Yeah.
With those tools in mind, where does the book show them making the biggest impact when it comes to actually managing chronic diseases? What's the first insight it highlights?
Well, one of the really compelling areas the source discusses is using AI for early identification and risk prediction. It highlights how these predictive models can analyze all sorts of diverse data points, patient history, demographics, maybe even lifestyle factors to identify individuals who are at high risk of developing a chronic disease before symptoms even show up sometimes, or people who are at risk of complications if they already have a condition.
Before symptoms, wow.
Yeah, and the book gives this fascinating example of it in action. It talks about AI-powered population health systems being used in Kerala to identify pregnant women at high risk of gestational diabetes. So by analyzing their data, the system could flag those individuals, allowing for, targeted interventions like lifestyle counseling or just earlier monitoring.
Wow, so it's not just about reacting to chronic illness then. It's about proactively using data to find people who might need help even before a diagnosis is confirmed. That really feels like a fundamental shift.
Exactly. It's a move from purely reactive care towards proactive intervention. And that's crucial if you want to manage the trajectory of chronic conditions, especially at a population level.
Okay, so identifying risk is one big area, but once someone is navigating a chronic condition, managing the sheer volume of medical information is just a huge burden. Test results, doctor's notes, prescription details, it's a lot. This is where the book talks about AI, particularly those LLMs acting as wrappers. What does the source mean by that? How does it help?
Yeah, the wrapper concept, as the source describes it, it's actually brilliant. It basically means AI tools that sit around existing data or systems. They don't replace them, but they make them more accessible or understandable. They essentially act as translators, turning complex medical jargon or data into more user-friendly formats.
Okay, like an interpretation layer.
Precisely. And the book details some specific, really high-impact examples using LLMs for chronic care patients. Think about lab reports, for instance. AI can extract your results, compare them to the normal ranges automatically, and then generate a clear explanation highlighting what's abnormal, what those results might suggest, maybe prompting you to follow up with your doctor.
Ah, okay. Instead of just getting numbers you don't understand.
Exactly. Or take prescriptions. AI can pull out the drug name, the dosage, the frequency,
Yeah.
and then generate easy-to-understand instructions on how and when to take it, maybe potential side effects to watch for, what to do if you miss a dose, all that stuff.
That's massive. I mean, I can instantly see how that empowers patients. It reduces confusion, which has got to be critical for sticking to medication plans with long-term conditions.
Absolutely. And the source really emphasizes this point. It leads to better patient understanding, fewer errors, and, importantly, improved adherence. Another great example the book highlights is personalized discharge instructions. After leaving the hospital, patients often get these generic sheets of paper. LLMs can generate simplified, really personalized guidance tailored to their specific condition and their recovery plan.
Right, tailored to them.
Exactly. But the book also points out, quite rightly, that for this to work effectively, especially somewhere like India, these wrapper applications need to be culturally sensitive, they need to support multiple languages, and they have to be accessible across different devices, different literacy levels. It's not just about the clever AI, it's critically about the user experience, how people actually interact with it.
That makes total sense. So AI helps us understand risk and makes complex information digestible. But what about the ongoing management, the day-to-day support, especially after someone leaves a hospital setting?
Right. Post-discharge care and remote monitoring, these are areas where the book shows AI making some really significant inroads. Think about remote patient monitoring, where data is collected from wearables or home devices. That generates a ton of information, right? AI steps in to interpret those trends, to make sense of it all.
Sifting through the noise.
Exactly. The crucial insight here, according to the source, is AI's ability to detect subtle changes in a patient's data. Changes that might signal their condition is worsening, often before it becomes critical. The source notes that using AI to analyze this remote data can lead to earlier intervention and, significantly, it mentions studies showing up to a 20% reduction in hospital readmissions for chronic conditions.
Wow, a 20% reduction in readmissions, that's huge. So AI is essentially acting like a constant vigilant monitor in the background, catching potential problems before they spiral into a crisis, allowing doctors to step in proactively.
Precisely. That's the idea. And the source also touches on other AI applications in this phase too. Things like virtual nursing assistants, handling routine patient questions 24/7, freeing up human nurses for more complex issues, or even using computer vision for tracking rehabilitation progress, like how well someone is doing their physical therapy exercises at home. It's all about extending that care and support beyond the clinic walls.
Okay, so bringing all this data together, the risk factors, the monitoring data, the patient information, how does the source say AI helps clinicians actually develop better treatment plans, plans tailored specifically for an individual?
Well, this is where predictive analytics for clinical outcomes and the integration of more advanced data like genomics really come into play, according to the book. AI models can analyze a patient's unique profile, their whole medical history, their lifestyle, even their genetic information, and compare that against vast amounts of clinical data and research findings to predict which treatments are likely to be most effective for that specific person.
Truly personalized medicine, then.
Getting closer to it, yeah. The source describes how AI can integrate genomic data analysis, identifying genetic predispositions or interpreting specific variants directly into the treatment planning process itself. And what's fascinating here is the vision the book presents. It's not just theoretical. It's about AI-driven personalized treatment selection, becoming highly integrated into existing clinical workflows. The source even talks about the potential for, commercial marketplaces for these AI-based treatment plans, leveraging standards like FHIR, that's Fast Healthcare Interoperability Resources, to ensure they can plug seamlessly into the electronic health record systems hospitals already use.
Wait, an app store for personalized treatment plans? That's a wild concept.
Yeah.
The book really frames it as a way to make this cutting-edge personalized medicine actionable for doctors right there in the clinic.
It really does. And it gives this great example of an oncologist using an AI platform for a patient with a rare type of leukemia. The platform didn't just suggest a standard plan. It generated one based on the patient's unique profile, but also adapted it considering the resources actually available locally, making it a truly practical recommendation.
Okay, that's key. Practicality.
Absolutely. And the role of FHIR, as the book highlights repeatedly, is just critical here. It provides that common language, that standard needed for these smart treatment plans to actually integrate and be used within hospitals' existing IT systems. It removes a huge barrier to adoption.
So we've painted this picture of incredible potential. AI identifying risk, explaining complex info, monitoring patients remotely, helping create personalized plans. But the book also grounds us in reality. It highlights the complexities, the challenges of actually implementing these AI solutions. What does the source say are the biggest hurdles to making this vision a reality, based on the implementation factors it discusses?
Yeah, implementation is always the tough part. Data, unsurprisingly, is foundational. The source repeatedly emphasizes that getting access to large amounts of high-quality, well-structured data is just paramount. Data cleaning, standardization, it's not glamorous work, but it's absolutely critical for building reliable AI. Garbage in, garbage out, right?
The foundation has to be solid.
Then there's infrastructure. You need robust IT systems, and you need seamless integration with existing healthcare technology, like those EHRs we talked about. This is where standards like FHIR come up again and again in the source as essential enablers for that interoperability piece.
Okay, data, infrastructure. What else?
The human element, user adoption, healthcare professionals, doctors, nurses, they need training, they need support, and frankly, they need to build confidence in these tools.
Yeah.
It's not just about throwing technology at people. It's about enabling the people who have to use it effectively and trust it.
Change management, essentially.
Exactly. And cost is, of course, always a practical consideration. The source suggests things like strategic phased approaches focusing on high-impact areas first, maybe leveraging open-source tools where feasible to try and manage expenses, especially initially.
Makes sense. Phased rollouts.
And critically, perhaps most importantly, data privacy and security. These are just non-negotiables. The book underscores the absolute necessity of robust measures, encryption, strict access controls, anonymization techniques to protect sensitive patient information. That's a massive responsibility when you're dealing with health data.
Absolutely. So those feel like universal challenges with implementing new tech in healthcare. But the book also pays specific attention to implementing AI for chronic care in the Indian context. What unique considerations does it raise there?
Right. India presents a really unique and complex landscape, as the book details quite well. First off, the diverse linguistic environment. You have so many languages. AI tools need multilingual capabilities to truly reach patients and providers across the country. That's a big technical lift.
Yeah.
Then there's connectivity. Low bandwidth or intermittent internet access in certain areas is a real technical challenge that needs specific, maybe offline-first solutions. Affordability is obviously paramount, requiring innovative, cost-effective models, perhaps different from those in, say, the US or Europe.
So accessibility in multiple senses, language, cost, technology.
Exactly.
Yeah.
The book also points out varying levels of digital literacy across the population. That means interfaces need to be incredibly simple, intuitive, easy to use, and then there's integration. Integrating with the evolving national digital health infrastructure, like the Ayushman for a Digital Mission, ABDM, is both a challenge and a critical opportunity according to the source.
Getting everything to talk to each other.
Yes, and doing it compliantly. Compliance with specific Indian regulations like parts of the IT Act, the new Digital Personal Data Protection Act, NHA guidelines, it's mandatory, not optional. But the source also highlights opportunities unique to India, like leveraging existing trusted community health worker networks, the ACJ workers, for example. Maybe equipping them with simple AI-supported tools on a tablet could extend the reach of care significantly into underserved areas. That's an interesting angle the book brings up.
Using existing structures, yeah.
And finally, a point made several times. Training AI models to be accurate and relevant for the Indian population requires large representative data sets from within India. You can't just import models trained elsewhere and expect them to work perfectly. That data foundation needs to be built locally.
Wow. Okay, we have covered a lot of ground in this deep dive, drawing exclusively from this fascinating source material. From identifying risk really early on, empowering patients with information they can actually understand, supporting that day-to-day management, and even tailoring treatment plans, AI clearly holds immense promise for transforming chronic disease management.
Yeah, and the book's conclusion really brings it together nicely, I think. It emphasizes that AI isn't about replacing human expertise or that doctor-patient relationship. It's more about providing powerful support, acting as, the source says, a diligent guardian, a personalized mentor, maybe a safety net weaver. It augments what doctors and patients can do, aiming to improve efficiency and, ultimately, outcomes.
It's definitely clear the potential is huge. But as we've discussed, the path to widespread implementation is complex, especially when you consider the nuances of different environments, like those highlighted for India grappling with data, regulations, infrastructure, and all those human factors.
And we connect this to the bigger picture. It really feels like it's about moving the needle in healthcare, particularly through these long-term conditions, shifting from a model that often feels reactive and maybe fragmented towards one that's more proactive, more personalized, and really centered around the patient's ongoing journey with their condition.
So wrapping up, what does all this mean for you, listening to this, thinking about healthcare for yourself, or maybe someone you know navigating a chronic condition? Let's end with a final provocative thought. Drawing from the source material's conclusion, consider that idea mentioned how AI in healthcare is ultimately about silently saving lives.
Yeah.
Saving lives not necessarily through dramatic interventions, but through optimized processes, earlier detection, more precisely tailored care happening quietly in the background. How might this silent transformation impact the actual experience of managing a chronic condition in the years to come? Something to think about.